Come next startup on the stage, Lab SD. Your time starts now.
Hi, my name is Holden Kim, and I'm a CEO of LabSD. There are about 253 million people who are either blinded or visually impaired. And most of them, 90% of those blind people or visually impaired people, live in low and middle income countries. The members of LabSD has been working to solve this problem as NGO workers, researchers, and finally, now we are working as a startup. We have finished developing the digital ophthalmoscope called the iLike, and I can assure you that it is the most efficient way of collecting quality fundus images at the moment. And we could keep the price down because we are using a used smartphone. And if you think about it, in the used smartphone, there's a screen, internet connectivity, computing power, and camera. And for that, we are collaborating with the Samsung Galaxy Upcycling Program along with Minted. So basically what we are doing here is the smartphones that otherwise would be causing environmentally harmful effect is now helping the people in the resource-limited condition to promote their eye health. And we also have developed the application along with the web-based information system, and we have set the team of doctors in Vietnam to diagnose the diseases. With the 20,000 images collected so far, we have conducted the first round of the AI, and we now have AI for AMD and glaucoma, which has 90% and 85% of accuracy, respectively. On top of those three elements, we are adding the online donation system to the whole platform. So basically, what we can do now is we can show how many patients are having which diseases and how much it costs to treat them. So we are going to be collecting the donation globally, and we can report to the donors what kind of a process the patients are going through. We have set the year of 2022 as a year of validation of the device and the platform. And we are conducting the pilot project in 5 different countries with the support from the Samsung Electronics and collaboration with the International Agency for the Prevention of Blindness. We have set the goal of providing at least one platform in 50,000 population by 2030, which is the number of vision centers that experts say IAPB and WHO are recommending in order to effectively curb the stem of the blindness. And at the moment, the number is quite short, and also the capacity of the vision centers are not good enough to diagnose the fundus-based blindness causing eye diseases. So with the iLike platform, they are going to be able to diagnose glaucoma, diabetic retinopathy, along with AMD, which causes 21% of the world blindness. We believe that Vietnam is a very good market for us, and it's a very good country to start with because there is undistributed eye health human resources in Vietnam, and there is a willingness of a government to solve the problem as well. It also is a technology-friendly environment, and there is a fast rate of development of the country as well. So we have conducted 2 rounds of a POC at the moment, and there is going to be one more starting from September of this year. And from the 2 rounds of the POC, we have collected a lot of data as well. And we now do have a representative office in Vietnam, and we are collaborating with a lot of partners in various fields. And this is the second round of the iLike platform. And there will be the diagnosis for the other chronic diseases, and it will be placed in public areas as a kiosk-type device. The members of LabSD has been solving problems that regards blindness and problems caused by the blindness. And we do know that we cannot solve this problem alone with the iLike platform. That's why we are trying to work with other partners in various fields, and we are looking for partners at the moment as well. Will you be joining our vision of eliminating avoidable blindness. Thank you very much.
Q&A session, please.
So one of the challenges of bringing AI into healthcare is how you convince doctor to use it.
Okay.
And then second is most likely that you don't want to change the doctor workflow. Rather, you have to bring the AI into their workflow.
Right.
Because otherwise, they won't use it.
Right.
So my question to you is, first, how you convince doctor?
Okay.
Okay, what is the differentiated product that you do?
Okay.
Second, what the certification that you get so that they can qualify to use it?
Okay.
For example, like approval by MOH,
Okay.
FDA approval,
Okay.
CE approval.
Sure.
Yeah, so thank you.
Okay. First of all, in the resource-limited conditions, like in low-income countries, because it is very difficult to have the fundus camera, which is to collect the fundus images. So this device will be substituting that sort of expensive devices. But in the countries more than middle-income countries, like Vietnam or Korea, ophthalmologists, eye doctors are not going to be using this because they already do have a really good device. And sometimes it works as an attraction for the patient to visit the clinic as well. So what we are trying to do is provide the devices to the local clinics like health centers or the internal medicine or family medicine, and those are the clinics that people with chronic diseases to visit to get the drugs on regular basis. And when they do it, we scan their eyes, and if there's anything wrong with them, we can refer them to the ophthalmologist's office. And those people who are having the chronic disease are one of the most dangerous risk group of those diseases that we are dealing with. And another thing is that by providing the devices to the public, we do not want to cause any conflict with the eye doctors. But for them, they don't get a lot of financial reward by diagnosing the diseases. But they get a lot of better financial reward by treating those diseases. So in a way, we are finding the patient for them because not a lot of people are engaged in the activity of screening their eyes. So there's this win-win strategy there. Thank you very much.
You have got representative office in Vietnam, right?
Yes, I do.
So, which means you didn't start the sales and making the profit yet. So, if you seriously expand your market in Vietnam, I think you should establish a foreign investment entity, something like that. So,
right.
Based on your research so far, because this is the medical side,
right.
Is there any license issues there, or what's your plan to cooperate with other partners in Vietnam?
Okay, we already have approval from Korea, and we got the ISO as well for the management of producing medical devices. And we are in the process of getting the FDA approval. We could conduct the POC in Vietnam because we had this exemption because whole project was like a part of the ODA project, and it was a donated goods. And there's this policy that if the device is not for sales, if it is like a donated good, there's we can go for the exam for the approval in the country. But of course, if we want to go for the sales, we need to get the approval, and we are in the process of it.
I have a question. So what is the current status of your AI solution development? Is it available now? You can scan and identify the problem with the eyes? Or
okay, we are going for the 3 different eye diseases at the moment. We can diagnose 2 of them at the moment, but we believe diabetic retinopathy is the most important one, but in the 20,000 images that we have collected, we didn't find a lot of patients, so it's not there yet. But we are collecting data in 5 different countries, and there is going to be another machine learning conducted at the end of the year. So we are working closely with the Diabetic Association for it. So we are expecting the better AI at the end of the year.
Have you been able to sign a collaboration contract agreement with the eye hospitals?
Thank
Yes.
you. Time's up.
Thank you very much.